Hi, my name is Peter Coyle, and I'm an assistant professor of research in the Department of Physical Therapy at the University of Delaware. My career as a scientist really started in more conventional clinical research. As a PhD student, my early work focused on identifying modifiable impairments that contributed to mobility loss among older adults with the hopes of developing more effective interventions. However, during this time, I began to appreciate the gap that exists in the generation of new scientific evidence and its translation into real-world clinical practice. As a postdoctoral fellow, I focused on building a foundation in health services research and implementation science. With the generous support of CoStar, I completed my postdoctoral fellowship at the University of Pittsburgh. There, I focused on scaling up and implementing community-based exercise programs for older adults. Additionally, I was involved in a larger research team that investigated the implementation success of a rehab care pathway for patients who survived a stroke using data from a large pragmatic trial. Through these projects, I had my first experiences investigating the barriers and facilitators to successful care transitions across the continuum of care for high-need patients. And given my interest in complex age-related conditions, I quickly became passionate about this area of work. In September, I will once again be partnering with CoStar as well as Brooks Rehabilitation Health Systems in furthering my career in this field. As a faculty fellow, I will continue to grow as a health services researcher that's dedicated to assisting health systems in improving the quality, efficiency, and value of the care they provide. Specifically, I will be assisting the Brooks Rehab Data Center Solutions team in analyzing nationally collected Medicare data to construct and explore post-acute episodes of care in the hopes of identifying high-cost, low-quality rehab for patients who have survived a stroke. We'll be looking closely at the transitions of care across the entire rehab continuum to optimize care pathways for these patients. In summary, CoStar has played a central role in my development as a health services researcher. I've had the opportunity to work closely with some amazing senior mentors, as well as network with junior investigators who have become valuable colleagues, collaborators, and friends. Most importantly, CoStar has been critical in launching my own independent line of research in a field that desperately needs more rehab scientists. I look forward to my continued partnership with CoStar, and I wholeheartedly thank the Foundation for Physical Therapy Research for their continued support.